Hello again. I want to follow up with last week's review of an article about maintenance care or wellness care. Important stuff as far as helping folks maintain what they've gained under chiropractic care, and it's real common for docs to recommend that. It's also exciting when we see well-done studies that demonstrate that it helps, because sometimes it's an objection that folks have to getting chiropractic care, when really the idea of maintaining what health gains we've achieved isn't too hard to understand. We do it with everything else in life, or we don't do it and we see the negatives related to not trying to maintain what health gains we've made. So today, the second of the two articles, this one's a study called Health Maintenance Care in Work-Related Back Pain and its Association with Disability Recurrence. So this is looking, this was a workers' comp, a survey of workers' comp results from the Journal of Occupational and Environmental Medicine. It's from 2011. So basically it's checking to see who prevents recurrence of episodes of low back pain. So let me just jump right in. This is going to be a tad bit repetitive, but much shorter than the last one. So what they're trying to do from their abstract is to compare the occurrence of repeated disability episodes across types of healthcare providers who treat claimants with episodes of work-related low back pain. So it's looking at what types of healthcare, what types of treatments are most likely to prevent flare-ups again, to prevent the patient from having a recurrence of their low back pain after being injured at work. So this is important. And it's a good study. They followed 894 cases over a year's time. So jumping right in to the end of the story here, the results showed that controlling for demographics and severity, the hazard ratio of the disability recurrence for patients of physical therapists or physicians, medical doctors, was higher than that of the chiropractor, and was similar to that of no treatment. In other words, the chiropractic was best. No treatment was slightly worse than not getting chiropractic care. But if you got medical care or physical therapy, that was actually making your chances of recurrence worse than not doing anything. Now, that's pretty amazing. You got to dig into this some, but that's how the statistics ran on this. So the conclusion was, in work-related non-specific low back pain, the use of health maintenance care provided by a physical therapist or a physician or physician services was associated with a higher disability recurrence than in chiropractic or no treatment. So digging in a little closer, their assessment was chiropractors focus more on a return to work, while physicians focus more on pain control, which we've talked about and I've talked about on these videos before. You know, just narcotics and covering up pain really isn't going to help at all with improving the health. So since chiropractors want people back to work, they tend to end up there. And we're actually not just doing symptom management, we're correcting something, we're correcting subluxations. They make the point chiropractic patients had less expensive medical services and shorter initial periods of disability than cases treated by other providers. It's good news for employers. Taking opiate pain drugs during the period of health maintenance care was significantly associated with recurrent disability. So if you're still taking pain meds and you're headed back to work and you're trying to prevent recurrence, that's a bad idea. or it's likely to be ineffective. So when chiropractic patients did suffer a recurrence, on average it was 29 days later than the physical therapy and physician patients who suffered recurrences. They speculate that the main advantage to chiropractors could be based on the dual nature of our practices, which is we do regular corrective care and then we focus on maintenance. That's just part of our DNA. So after controlling for the severity and demographics, no health maintenance care is generally as good as chiropractic care. Of course, there was the statistical difference, and we'll see later that their idea of maintenance care was as infrequent as once every quarter. And so, like I mentioned on the prior video, there's real good reasons to understand that that isn't really maintenance care. So when you factor in, if in this study you're able to eliminate the ones that went so long between maintenance visits, it would have made a dramatic difference in results. Chiropractic patients, this is great, had fewer surgeries, used for fewer opioids, and had lower costs for medical care than other provider groups. And after controlling for demographics and multiple severity indicators, patients suffering nonspecific work-related low back pain from the chiropractor had a lower risk of recurrent disability than a risk from any other type. And they also noted chiropractors are the only group of providers who explicitly state that they have an effective treatment approach to maintain health. So I thought that was pretty amazing. We always talk about maintaining and continuing to some degree to try to achieve that wellness level or to achieve that functional level where recurrences and flare-ups aren't going to be happening like they were when folks first come in. So I was surprised. I mean, that struck me because it seems everyone would want that, and it seems odd that other disciplines wouldn't talk about that right out of the gates. So anyway, great study that shows what chiropractors consider maintenance care, in particular the adjustment, is most effective at preventing relapses. And I also feel the need to say, I refer to physical therapists, I refer to medical doctors. I've used both. This is one study. I'm not reporting on this to bash those professions for a second, but I like it because of the things that it actually hashes out. And pretty definitively states that if you're looking to avoid recurrence, the obvious way is to go with the chiropractic care, not just symptom management or looking to get out of pain as quick as possible. So hopefully that was helpful. I didn't muddy the waters much. The moral of the story is, if you put in the hard work to correct subluxations, reduce your pain, and restore function, get your life back, there's also really good evidence to show if you come in for wellness care periodically, that's going to maintain that function. That's going to maintain your independence. That's going to make sure you keep your life that you've gained, daily activities and function. So appreciate your patience. Hope this was helpful. See you next time.